The first thing I'm going to do is review the patient's chart to determine gender and any medical conditions that might play a part in today's assessment. I'm going to introduce myself. My name is Maria Hurtado, your student vocational nurse. Can I have your name and date of birth, please?
January 22nd, 1992. My name is Belen Zumaya.
And then I'm going to ask for any allergies to latex.
None.
And then I'm going to do proper hand washing technique, and I'm going to tell her what I'm going to be doing today. I'm going to be doing a cardiac assessment on you today. And then I'm going to provide privacy for the patient. I'm going to move the table to working height, and I'm going to take the apical pulse from the left mid-clavicular line and the 5th intercostal rib for a minute. Her apical pulse was 76. I was listening for the S1 and S2, and then I would do the aortic valve on the right side of the sternum and the pulmonary valve on the left side, and then the tricuspid would be the 4th intercostal rib. And I would just be listening for murmurs or any abnormalities, and I would chart them in her chart. She's all good, so I would lower the bed to the lowest position and make sure the wheels are locked. I would make sure the call bell is within reach, and I would ask if she needs anything, and I would perform proper hand washing, and I would document all the findings I found today.